Okay, hello everybody, and welcome to the second of our We Are Wellbeing Insight reports. And today we are joined by Dr. Emma Burgess, who's our clinical psychologist, and we're going to look at an insight into mental health. So, hello Emma.
Hello, hi, nice to be here.
Oh, yeah. So, at We Are Wellbeing, our aim is to create a place where people thrive, and obviously, mental health is a really key topic in order to do that. So, Emma, would you mind giving us a little bit of a definition as to what is mental health?
So I guess it's quite difficult to define, but we've included here the World Health Organization definition for mental health, a state of well-being, in which an individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively, and is able to make a contribution to his or her community. I would say mental health is really a spectrum, and we all sit somewhere along this spectrum. And actually, it's not a static thing in that we sort of move from one position to another throughout the course of our lives, depending on what's going on in our external and internal environments. But I think really it's an ability to function optimally and to do the things that are important to you in life and that you value. And you know, as I said, it can vary over the course of life.
Lovely, thank you for that. So one thing that we're aware of here at We Are Wellbeing is the mental health continuum, which is this diagram that's on the screen. So is this something that you're familiar with and use in your work, Emma?
Yeah, I mean, I think diagnoses are, you know, some people really value having a certain diagnosis. It can get them the help and support that they might need. It can make sense of different symptoms or things that they might be experiencing. But other people find that a diagnosis can be that having that label can maybe limit them or make them or come with an associated stigma. So I think we all sit, as I said, we all sit somewhere along a spectrum of mental health, and you may have, you know, a formal diagnosis of a mental health condition, but actually be functioning really well in your life, and be able to, you know, do the things that you want to do, which I guess would put you in that top left area of that diagram here. Whereas you may also have no formal diagnosis, but have a generally poor mental health and not be functioning really well. So that space in the right bottom quadrant. And then, you know, you may have no diagnosis, but also have poor mental health and not really be functioning. And, you know, equally you could have, you know, no diagnosis and be functioning really optimally. So I think, you know, and whether or not somebody has a diagnosis or not can sometimes depend on whether they've sought any help from, you know, GP or other services. And, you know, diagnoses in themselves are more a collection of different symptoms, which you may or may not identify with. But I think the key point here is that we all sit somewhere along this continuum. And the important thing is whether you're able to function and kind of optimize your life how you want it to be.
Lovely, thank you. That's great. So one of the things we wanted to talk about today was around kindness, because this is one of the key topics this year that's being rolled out in mental health. And we know that this has a profound effect on both your physical and mental health. So can you tell us a bit more, Emma, about the link between kindness and mental health?
Yeah, well, I think firstly, I'd like to say that I tend to follow the work of a very experienced psychologist called Paul Gilbert, who's written lots of books on the compassionate mind. So I would really use him as a guide when thinking about kindness and compassion. He broadly defines compassion as a sensitivity to suffering in both in yourself and to others, but also a commitment to try and alleviate and prevent it. And actually, being compassionate does require courage. It requires a willingness to see the suffering in ourselves and others, which can be unpleasant and uncomfortable for us. And it also requires wisdom to address it. And actually, it's been shown that kindness and compassion strengthen our kind of parasympathetic nervous system. So the autonomic nervous system is made up of parasympathetic and sympathetic branches. And the parasympathetic is your kind of relaxing, rest and digest nervous system. And there's something called the vagus nerve, which is also strengthened by being compassionate and kind. And this leads to better mental health and well-being. And I think in this time, this very difficult and challenging time for us at the moment, coming from a position of compassion can really change our kind of outlook and way of relating to each other. So even just rather than using the term social distancing, thinking about safe relating, so being able to come from a position of compassion that we're actually trying to keep ourselves and others safe, from a position of kindness can help us to deal with this very challenging time rather than see it as threatening.
Yeah, there's some really
And I think also, as you said, kindness and compassion reduce our stress and do release hormones such as oxytocin, which also help us to relax and feel better.
Thank you, Emma. That's really useful. Really interesting how kindness can have that effect, and I guess it acts as a bit of a domino effect, really. If one person's then kind to another, they in turn will then want to be kind to those around them. And you're right, that should help us all feel much less stressed and more supportive of each other as well. At the moment, I guess, especially because humans are quite social creatures, that kindness is really important there. So thank you
exactly.
for that. Okay, so moving on, sleep opportunities. So we know there's a really strong link between sleep and mental health, but also obviously physical health. But can you tell us a bit about the importance of sleep and some of the things that you know in regards to mental health, Emma?
Yeah, so I think, there's been a whole huge amount of research into sleep and how it's really important for a variety of different things, both in terms of our mental health and in terms of our physical health. We don't know exactly the function of sleep, but we do know that it helps lay down memory. It helps improve our cognitive function. It helps regulate our hormones, in particular our hunger hormones. It's protective. If people don't sleep, eventually we wouldn't be able to live without sleep. So it's extremely important. And actually being deprived of sleep can really affect our mood. And I'm sure, when we've had not such a good night's sleep, we're usually more irritable, our mood is lower, it's more difficult to function. And if that builds up over time, it can make life very difficult. And I think having said all of this, actually, we could know how important sleep is, but if we're struggling with sleep, it's very difficult and challenging to break out of that cycle. And actually having all that knowledge of, I need to sleep, if I don't sleep, it's going to be bad for my health, can almost increase that pressure to try and sleep. And of course, as we all know, the more we try and struggle with sleep, the less likely sleep is to come. And I tend to follow the work of a sleep doctor called Dr. Guy Meadows, who's written some really good books about optimizing sleep opportunities, I suppose. And his approach is more about letting go of the struggle to sleep. If we struggle to try and get to sleep, we become more aroused. We see not sleeping as a threat, and this means we're less likely to sleep. However, if we can really optimize our conditions and environment for sleep, perhaps let go of that struggle, allow ourselves, for example, an 8-hour opportunity to sleep, and sleep might come and sleep may not, but by letting go of that struggle, lying quietly, observing any difficult thoughts and sensations that might come up, but allowing them to be there rather than getting caught up in the struggle, that in itself can help us to sleep better, although, it seems a bit counterintuitive. And I guess his book, the sleep book, it is really does detail this, and I would encourage people, if they are struggling with sleep, to seek out that resource. And I think there are some basic sleep hygiene points that can help to optimize your environment for sleep. So things like having a cool room, having a comfortable bed as far as possible, having some kind of darkness, not drinking caffeine right before bed, and all of those things, but also, not becoming too heavily reliant on those things for sleep, but holding them lightly, I would say.
Okay, that's really interesting, really helpful. Thanks, Emma. Sorry, just went the wrong way. Okay, so we also spoke about one of the key topics to cover in this as being present moment awareness. So would you like to explain a bit about that for our listeners, please, Emma?
So I think a lot of people have heard of something called mindfulness. It's quite popular at the moment. There are various apps and resources that promote this mindfulness approach. And we know from a lot of research that practicing mindfulness, which I like to really think about as present moment awareness, so noticing what's happening both internally in terms of our own inner world, and then externally in terms of our environment, can really help with a whole host of different things. It can help with mood, with reducing anxiety. It can help with a whole host of physical and mental health difficulties. And really it helps us it can help be a tool to help us to function more optimally. And I guess really to kind of define what this present moment awareness is, it's really about paying attention and noticing any thoughts, feelings, sensations, the environment that you're in. And in that noticing, we can get a bit of a space from those things, so that we can not be so pushed or pulled around by our own inner thoughts and difficult feelings, but we can actually have some space to make a choice to move in the direction that we want to move in life, even when those difficult thoughts and feelings and sensations show up. So we don't get so pushed and pulled around by them. So I think mindfulness is a really useful tool to notice things that show up, and to be able to have a little bit more control over their impact on us. And you could practice mindfulness formally in the form of a meditation or a breathing exercise. Often the breath is useful to use as an anchor, as something to focus on and keep coming back to when our mind is pulled off course. But we could also just be paying attention to the environment around us. We could be doing a simple task like washing up and paying attention to, the sensations and everything that shows up. We could practice mindfully eating. We might be moving our bodies, and that might be a useful way. So I think, there are many ways to practice mindfulness and present moment awareness, and it's really about finding things that work for you.
Lovely, thanks Emma, that's really helpful. I know that when I've done some reading on mindfulness, it shows that actually by practicing it just for 10 or 15 minutes a day, it can increase the density of the grey matter in your brain, which has been shown to improve concentration and also cognitive ability. So I guess there's real benefits in doing that, especially, if you've got a hectic life and you don't feel that you've got the time to spend on it, it almost has a benefit that goes beyond that amount of time that you've invested in doing it. So
absolutely.
It's certainly
I think often people think they don't have time, but actually it can kind of almost give you more time back because you're in a better position to be able to be a bit more productive during your day, as you mentioned. And it doesn't need to be 10 or 15 minutes. It could be, a 1 minute breathing exercise. You could do, just sitting down, or it could be just a few moments to sort of ground yourself in the present moment. It doesn't need to be a lengthy formal thing.
Yeah, absolutely. No, that's really helpful. Thank you. Okay, so our last topic that we're covering in this webinar today on this introduction to mental health is around doing what matters. So Emma, can you share a bit with us about this?
Yeah, so I work in my clinical practice. I usually use an approach called acceptance and commitment therapy, or ACT. And I guess doing what's important to us in life, so thinking about our values, the kind of person that we want to be, what we hold dear to us, is really the kind of compass that guides the direction of what you choose to do or not do in any given situation. And so really what I think is very valuable is getting people to think about what really matters to them, whether it's friends, family, personal development, work, hobbies, all of those things. And maybe how much they think they're moving towards those things in their lives. And there may be a bit of a gap. So it may be that with your work, you're kind of really optimizing that, but actually the relationships in your life are a little bit neglected. So I guess that actually relationships are really important to you. So that would kind of guide some of your behavior and some of your choices to maybe set some goals in line with, moving towards improving your relationships. And so I think values are really, or doing what matters to you is really like a compass that guides the direction of things you choose to do and not do in your life. And actually by doing what's important to you, by being the sort of person that you want to be, that really improves your well-being and generally your quality of life. And I think it can help if we're really aware of why we're doing what we want to do, and if we're doing something that is really important to us in life, then it allows us to, even though we might have difficult thoughts and feelings or barriers that show up, it allows us to continue moving in the direction because those things, towards the things that matter, because those things are so important. So I think, it's helpful for all of us to think about what really is important to us, and are we doing those things, or are we getting caught up in things that perhaps don't matter as much?
Yeah, and it's all too easy to do that. I mean, it sounds quite straightforward, isn't it? But we know from personal experience that a lot of the time we are doing things that aren't really congruent with our values or with what's important to us, to either make other people happy or because we feel that we should be doing something. And they're all quite negative thinking beliefs. So this is really...
And I think it just helps to take a step back from where we are and to really evaluate, we all have probably lots of different things that are important to us, and how balanced does that look? Often I see people that the balance is really heavily weighted towards work, or even towards family and looking after children, and perhaps their own kind of personal development. They've neglected that, and yet that's really important to them. And so, it's very difficult it's extremely difficult to maximize everything that you want to do all at once, but maybe just thinking about redressing that balance and setting some goals in line with values can really help us to move in a direction that's positive, rather than feeling stuck. It can help us to become unstuck.
Lovely. Thank you for that. That's really helpful. Okay, so a summary of what we've covered today with Emma's help is, what is mental health? So a definition of what is that and why is it important? We've looked at the mental health continuum, so the fact that everybody sits somewhere on this continuum, and it's about understanding where you sit, but also, being able to know that whether it would be helpful to you to have, when you're going through struggles, whether you need a diagnosis at that point in time to help you, or if you need to get unstuck, as Emma mentioned, but an awareness of the fact that there shouldn't be that stigma around mental health, because we all have mental health, and it's just about where you're sitting on that spectrum at any particular time. So it's an awareness of that. So we talked about kindness as well, so the benefit that has on your individual mental health, but also in turn to those people that are receiving your kindness. That's really nice for them to receive as well. We talked about sleep opportunities and the correlation between good sleep and good mental health, ways in which you can do this, and some of the hygiene factors that Emma mentioned around the cool room, making sure you're not hungry or not too hot and things like that, and a nice relaxed mind, and trying not to worry about not being able to sleep. We talked about the present moment awareness, so being mindful in the moment, so taking time to just think about one particular activity and not letting other obtrusive thoughts go into your mind, and the benefits that have onto your overall mindset and cognitive function. It's really beneficial to take that time to do that, because of the effects that it has on your brain and the ability to optimally function. And we talked about doing what matters and how that links to acceptance and commitment theory. So doing what's important for you and being congruent with your values to make sure that you're maintaining your mental health for optimum benefit for yourself. So I hope that's been a really insightful and useful talk for you. This is just an insight into mental health. So we have a lot more material and things like that are available to you. So please do get in touch with us. We have a hello@wearewellbeing.co.uk email address. And Emma's kindly offered to answer any questions as well that come through, so I can forward those on to her. So do get in touch if there's anything that you have any questions with today. Stay safe, and we look forward to seeing you again for our third insight into the series later this week.